If you're caring for someone with a wound that won't heal, there's a good chance poor circulation is the hidden reason why. And in the next few minutes, I'm going to show you the early warning signs most people miss until it's almost too late. Here's what I find scary. A wound can look clean with pink tissue around the edges, no obvious infection, and everyone thinks it's healing just fine. But underneath, the blood flow is so poor that no matter what dressing you use, no matter how perfect your technique is, that wound is slowly dying from the inside out. By the time someone finally checks circulation, you've lost weeks, sometimes months. And in the worst cases, you're talking about amputation. What you do next could save a limb. For those who don't know me, my name is Dr. Cassandra Voltaire. I've spent years working in wound care, not just reading about it in textbooks, but standing at the bedside with patients whose wounds weren't healing and nobody could figure out why. I remember one patient clearly, an older patient with diabetes, small ulcer on his heel, which looked manageable. The prior provider tried everything, advanced dressings, offloading, infection control, and nothing worked. So I checked his ankle brachial index. It came back 0.4, which is severe arterial disease. That wound never had a chance. That moment changed how I practice, because you can do everything right on the surface, but if the blood isn't getting there, you're just putting a Band-Aid on a sinking ship. If you're watching this right now, maybe you're a nurse, a caregiver, a family member trying to help someone you love, and the wound just isn't responding the way you thought it would. Maybe you're second-guessing yourself. Maybe you're wondering if you missed something. I want you to hear this clearly. You're not alone. A lot of people miss these signs, even experienced clinicians, because poor circulation doesn't always announce itself. But you're in the right place, and by the end of this video, you'll know exactly what to look for. Here's what we're going to cover. First, what poor circulation really means in wound healing and why it's so dangerous. Then, the most common mistake people make when they don't recognize it early. I'll show you the warning signs you can spot with your own eyes. No fancy equipment needed. We'll talk about what you must do first when you suspect poor circulation. I'll share a real patient story that shows what happens when circulation is ignored and what happens when it's caught in time. And at the very end, I'll give you one unexpected detail that will change how you assess wounds forever. So let's start with the basics. What does poor circulation actually mean? In wound care, circulation means blood flow. Blood brings oxygen, nutrients, immune cells, everything the body needs to repair tissue. When circulation is poor, usually from narrowed or blocked arteries, that delivery system breaks down. Healing slows, infection risk rises, tissue starts to die. And here's a key point most people miss. Poor circulation doesn't make healing harder. It makes healing impossible. A wound is not just a skin problem, it's a whole body problem, and circulation is the foundation. Here's where things go wrong. The most common mistake I see is treating the wound aggressively without ever checking blood flow. People debride, they pack the wound, they use moisture-heavy dressings. That can be fine if circulation is good, but if blood flow is poor, especially arterial disease, aggressive debridement can make things worse. You remove tissue the body can't replace. You create a larger wound with less chance of healing. What's happening underneath is simple. The tissue is already starving for oxygen. Debridement raises the demand even more. The body can't keep up. Inflammation increases. The wound deepens. Infection follows. I've seen it over and over. Small wound, bigger wound, hospital, admission, limb loss. All because no one stopped to ask, is the blood getting there? And even experienced clinicians struggle here. You think, maybe it just needs more time. Maybe the dressing isn't right. Maybe there's an infection I'm missing. So you keep changing things and hope that something works. It's exhausting. And that's actually why I created the Wound Care Circle. It's a community for clinicians and caregivers who manage wounds and want a place to talk through cases like this without overwhelm. We break down real situations every week. So things like poor circulation, stalled wounds, gray areas. It's about support and clarity. So if that sounds helpful, you're welcome to join. But either way, let's keep going. Because what comes next is something you can use immediately. So what do you do first when you suspect poor circulation? So step one is to stop and assess before you treat. Ask about risk factors like diabetes, smoking, high blood pressure, high cholesterol, heart disease, and past vascular surgery. Any of these should raise concern. Step two is to check pulses like the dorsalis pedis and posterior tibial. Are they weak or absent? Document it and escalate it if needed. Step three is to look at the skin. Is it shiny, hairless, cool to the touch, deep red or purple when the legs hang down? These are signs of long-term poor blood flow. And remember this rule. An ABI below 0.9 means arterial disease. Below 0.5 means that you stop. No debridement, no packing, protect the limb, and get vascular involved. But sometimes you don't have an ABI right away. So what can you spot with just your eyes and hands? Look at color. Pale or bluish when elevated and dark red when dependent when the leg is lowered is a red flag. Also check temperature. 1 foot colder than the other is a red flag as well. You could also look at the skin texture. Is it shiny, thin, no hair? That is concerning. Check capillary refill too. More than 3 seconds is concerning. And ask about pain. Is there pain at rest? Pain at night? Worse with elevation? Better when dangling the leg? And look at the wound itself. Is it dry, black, minimal drainage? Pale tissue instead of healthy red? These signs mean proceed with caution. Here's the counterintuitive part. People see pink tissue and think, good, it's healing. But you can see small islands of granulation even when circulation is poor. The body is trying with limited supply. The wound stalls. It doesn't close. Sometimes it gets bigger. So don't trust appearance alone. Always connect it to the whole picture. So that means pulses, skin, symptoms. If circulation is borderline, be conservative. So protect first and push healing later. Let me tell you why this matters. A woman in her 70s, diabetic and a smoker for 40 years, had a small ulcer on her toe. It was dry and had dark edges, and it wasn't infected. Home health kept debriding. Each time the wound got bigger, she had pain at night and had a cool foot, no pulses, and no ABI had been done. When she reached me, half of the toe was necrotic, and her ABI was 0.3. That means severe disease. She lost the toe, and it didn't have to happen. Circulation should have been checked first, always. So here's the action plan. Assess circulation before treating any wound, especially in high-risk patients. If circulation is poor, do not debride aggressively. Protect the tissue. Use gentle dressings. Get an ABI quickly and refer to vascular. Don't wait. Educate the patient as well. Make them part of the team. If circulation is adequate, then move forward with standard wound care. The rule is simple. Circulation first, wound care second. And when you do it right, this is what healing looks like. Skin warms, color improves, pain decreases, granulation becomes healthy and red. Slow, steady, real progress. You didn't just treat a wound, you treated the cause. Before you look at the next wound, before you decide to debride, before you choose a dressing, check temperature. Feel both legs, both feet. Even a small difference matters. That one detail can tell you if the wound has a chance to heal or if you need to stop and dig deeper. But noticing it is only half the story. The real challenge is knowing what to do next, because arterial and venous disease are treated very differently, and confusing the two can cause harm. So in the next video, I'll show exactly how to tell the difference clearly, safely, and step by step. Click the next video on your screen. Stay informed and heal well.